Goodbye, echo. Welcome, seeker. 가슴에 자신감을 심어드리는 라이안성형외과 원장 최상훈입니다. 오늘은 상파울로 대학의 유명하시고 저명하신 문호주 교수님을 모시고 가슴 성형의 트렌드와 최신 동향에 대해서 알아볼 예정입니다. Mostly I use Motiva implants for secondary cases. What's your preference these days?
For secondary cases, I have been using only Motiva due to the benefits that I already mentioned in primary and secondary. I use it for more than 17 years for stable macrotexture implants. So I have a lot of my own patients that I did surgery 10 years, 15 years, 20 years ago with a macrotexture form stable. And now the patients come back to replace the implants. So 100% I indicate smooth silk implants, ergonomics or round style with good results. I don't have any experience anymore with macrotexture. The last macrotexture that I used was in 2017. Then we have the approval of Motiva in Brazil, and then I use it only smooth surface.
I think it has less capsule contracture and less problems using Motiva implants. Do you use drains usually or not?
No, primary I don't use anymore. Secondary cases, not 100%, but I can mention that in 95% I don't use drains. I don't do any more total capsulectomy unless the patient wants. You know, we have nowadays in Brazil a fashion of breast implant islanders that patients came for explantation and they want a monoblock procedures. And in these specific cases, if the patient asks for the procedure and I recognize that I will not have any problems in terms of total capsulectomy, it's a premuscular implant, etc. I do the total capsulectomy in this situation, and in this specific case I use drains. But for a partial capsulectomy or capsulotomy, I don't use drains anymore. The only indication is for recon cases, primary recon, when I use ADM. So in my practice, it's the only indication.
One question is about BIA ALCL. A lot of women who had the macrotexture implants before and they try to move the implant or exchange the implant. And I have a lot of concerns because there are a lot of thin patients. If I do total capsulectomy, they have less tissue.
Yeah.
So I always worry about whether I should do total or just partial or just leave the capsule. What's your opinion about
this? This is a very important question, and it's we have the same doubts in Brazil. I think basically we don't have any data about this procedure. We don't have any results and compare the patients that had a total capsulectomy in order to prevent the ALCL issue or even the breast implant islandness prevention if the patient had a total capsulectomy before. I'm a capsule addicted. I like capsules, especially for re-op cases, because with capsule we have a lot of strong structures to stabilize your new implant.
Yes.
You can perform a capsular flap, you can put a lot of stitches in a capsule, you can use the capsule as a natural ADM in order to support and protect your new implant. You can burn specific areas of the capsule in order to reduce the dimension of your pocket. So capsule is your friend and you have to use the capsule in your team unless in the near future we have data and strong data about the behavior of this capsule in terms of ALCL prevention. And from the best of my knowledge, we don't have the numbers and if this procedure is effective in terms of prevention. So I maintain the capsule. I use the capsule to stabilize the implant. I think it's more important then you try to remove the whole capsule, and you don't have any scientific support to do this. But you have another problem, because maybe the patient is so thin, as you mentioned,
Yes.
and you have some problems in terms of visibility or local complications,
Yes.
rippling, etc. And the worst scenario is to have implant instability, because you can imagine a thin muscle and you remove the whole capsule and you have a wide pocket with a smaller implant
You
with
move
no
around.
no adhesion. I'm sure that you have some problems in terms of stability. You have to do another surgery to correct these problems of displacement or total flip. So you have to balance the indications and the real indication for total capsulectomy.
Yeah, I think it's just kind of like social media, kind of like a procedure to doing monoblock
Yeah.
capsulectomy. And a lot of like women are really obsessed with doing total capsulectomy, and they think that breast illness is kind of like a big problem. I think a lot of doctors in the US and also in Korea, I don't know about your opinion, but I think it's one of the main anxiety disorder. And do you have any comments about breast illness?
Yeah, I think we know that there is no relationship between the cause and the effects. We have a specific group of patients that really have the symptoms. The great part of the cases are related to older implants, and older implants more than 10, 15 or 20 years.
Yeah.
We know, based in our research, and especially the MIT studies, that inflammation is totally different if you compare different type of surface. And if you compare the traditional smooth with the smooth silk and the macro texture, the macrophage activation is
Yes.
totally different
Of course.
between these two type of surface. If this activation of the inflammatory cells has any relation to the etiology of the breast implant illness, we don't know.
Yeah.
Patricia studied this. She calculated and evaluated a lot of immunological markers, and there is no relationship in terms of these immunological markers and the presence and the degree of the symptoms before and after surgery. So nowadays we don't have a diagnostic test, and we don't know what happened in this kind of disease. In my opinion, 80% of the patients has some psychological basis in terms of illness afraid. And 15-20% has a real cause.
Yes.
And in this specific group, the great part, more than 90%, are related to older implants, aggressive textures, and a genetic alteration in the patient that predispose to have a rheumatologic disease.
Yes.
This is my opinion.
Related with surgery time, a lot of Korean doctors criticize the shorter the operation time, like the surgeon might hustle in a very like quick situation. But for me, it has less exposure of the soft tissue to the air and exposure to the infection. I saw a lot of your articles, and you're a very time-efficient surgeon. What's your opinion about this?
Yeah, I think if you reduce the operative time, of course, that you have less chance of contamination. There is a direct relationship between the operative time and complications. Not only infection, but problems in terms of thromboembolic a disease.
Yes.
And other complications that you can have in any kind of surgery. But if you reduce your operative time, if you are efficient, precise, with an adequate hemostasis, during a short period of time, the risk for contamination is less. So to be efficient, you have to do a standardization in your whole procedure. And it's not only with you, with your assistants. So if you divide the whole surgery in 4 steps, and each step you have at maximum 10 to 15 minutes, you can do in 1 hour at maximum a primary breast augmentation very efficient.
Yes.
So if you do this every day and every day, the chance to do any mistake, so you have to have your standard, you have to reduce the operative time in order to avoid the additional contaminations.
Thank you. Today we prepared a cake together with Professor to celebrate women's health and happiness. This is because breast surgery can be a significant gift for women starting a new chapter in their life. We hope this cake brings joy to many women out there.
Thank you so much. It's a great honor for me to be here and have this very nice discussion about important points related to aesthetic and recon surgery. And thank you for the cake and the ceremony. It's very good.
Thank you for your time. I know you are a very busy plastic surgeon, doing surgeries in your hospital and also doing a lot of presentations all around the world.
Thank you.
And I'm very honored and delightful to have you here with my staff and seeing you.
Thank you.
Yeah.
Thank you. It was my pleasure.
No, thank you. Thank you. 여러분들께서 많은 도움이 되었으면 좋겠습니다. 지금까지 산파울로 대학교에서 오신 문호주 교수님과 함께하는 가슴 트렌드 그리고 가슴 수술에 대해서 알아보는 시간이었습니다. 다음에 또 봐요.